Welcome back to Insight, brought to you by Octet Solutions and Blissful Blessings Events. Now, we've talked about your old hat as a math teacher.
Mm-hmm.
What about your current career as a healthcare professional?
Well, after being a middle school teacher for that 3-year period, again, going back to just how I felt, it was just I got burnt out.
Right.
Without the support, it just felt like it was overburdening, and I just could not continue. So I decided, since I had had experience in the healthcare field in the past, I decided to go in that direction. Then later on, while I was in that field, because I worked as a film librarian, I decided to go ahead and pursue radiography because this position was available. I had seen it. I thought that I could do it. There were schools and programs available, and I applied myself and became a radiographer.
In doing so, you're moving from a clerical position to more of a hands-on healthcare provider position.
Mm-hmm.
So, in light of this State of the Union and the backdrop of healthcare being one of the biggest issues in America and one of the biggest drivers of cost, the Affordable Health Care Act has not been fully implemented right now.
Mm-hmm.
But have you noticed any changes in the way that you've had to perform your duties as a medical professional as a result of the little bit of what's passed?
Well, as far as what has passed currently, it really hasn't affected me significantly. And again, that may be because not all of the initiatives have been implemented. I have to admit, I haven't read the laws and that are going to be coming down the road.
Neither are some members of Congress either.
I understand that. So,
are there things that you anticipate changing in the future from what you do know about it?
Well,
for you or your colleagues?
I was going to say, at least from my experience working in a hospital setting and now working in an urgent care setting, it seems what's happening is, and this is probably true across many businesses, not just healthcare, is that these businesses are trying to cut costs any way they can, and at least in the healthcare industry, what I've noticed is, and speaking with some of the physicians that I've worked with, like in the hospital setting, I worked as a radiographer. I worked nights with another radiographer. We had 2 people covering a hospital that had approximately, I believe, 700 patients about. So we had an ER. We had to cover an ER, ICU, CCU, IMC, OR, NICU. 2 people covering all of these areas for an entire shift. This particular hospital was taken over by a conglomerate. About maybe 3 months later, the person that I was working with was let go. Obviously, he had some issues, but I believe that the issues were foisted upon him to be let go. Same thing happened to me. I was let go as well, and then what had happened was they decided to merge the evening shift position and the morning shift position to cross cover. What I'm getting at is that here you had a situation where you had 2 radiographers covering this entire hospital. Now you're left with 1 person covering the same amount of beds, the same situations. Can you imagine trying to cover the ER and having an inpatient crisis occur where you have to go up and do a portable chest and leaving the ER by itself? What's happening is you're having these cost containments that are occurring. Same thing with my current position, the urgent care setting. What I've noticed is that it seems like they're beginning to rely more upon nurse practitioners to be the frontline clinicians as opposed to physicians. Physicians are being drawn back more into a supervisory role. I myself am working not only as a radiographer but also as an MA. So I'm being asked to wear multiple hats so that way, again, cost containment. You don't have to hire 2 people to do 2 positions, you hire 1 person to do both. Now,
do you think this is going to happen some more with the Affordable Care Act? Do you think this is going to only get worse?
I would imagine it would have to. Like I said, my concern is that you know, and again, you see this across a spectrum of issues, like with education. When you talk about cost cutting, I think what's happening is the federal government is acting as the first payer when it comes to student loans in education. What happens? Universities know that they can get their money guaranteed by the government. They raise their prices. Same thing, I believe, is going to happen with healthcare. Government comes in, they're going to be the single payer of choice, and the healthcare industry is going to raise their prices so that way they make sure they get paid, because they're going to charge $100 for an aspirin to make sure that they get paid their $5 or whatever it is that they're seeking to cover the other costs. So, yeah, I think it's going to get worse rather than getting better, because competition is really what stimulates cost reduction, not monopolies.
Well, I think one of the problems, what makes healthcare different in competition, is that people don't shop around the same way that they do with products that they purchase. You know, you may be getting an MRI at one place for $5,000, and then down the street it's $8,000, and it's the same service, and you have no idea how much it costs because you have an insurance that's covering this sort of thing.
Mm-hmm.
Also, I think one of the things that the Act is trying to do is standardize costs. Working in government contracts, what I see are things called labor categories, where they say, you know, this product, this service, this position is given this general rate, so that you don't have these massive variance in costs for the same type of service, especially in a particular region. But go ahead.
I just wanted to, I guess, focus on your discussion of the variance of cost. At some point, you would perhaps prefer a variance of cost if you think of it as a sliding scale for those that can best afford versus those that can least afford.
I have no problem with variance of cost in things. You know, just as you said, you know, competition really helps with maintaining a reasonable price for things.
Mm-hmm.
The fact is that healthcare is different because people are ignorant to these costs, and people are not concerned about the costs as much as they would if they had to pay things out of pocket versus having a health insurance.
Now, there's a lot of people who talk about that, and one of the critiques of that is because health insurance in the United States is not really health insurance, it's a health payment plan,
Mm-hmm.
right? Where it's a third party that will pay as long as you pay your premiums, it's going to pay these costs. So you don't really know how much it costs.
Right.
So, you know, all of this stuff is being negotiated on a third party, so you have no incentive to find out whether the test you're going to get is $500 or $5,000.
Right.
Unless,
so that's why we're having this problem now is with variance of cost and you know, shopping around and all this stuff, because why would you shop around? My insurance is going to pay.
I just wanted to bring up just a anecdotal reference. When I was unemployed, I had no health insurance. I ended up, I think it was 2 years ago, with a kidney stone. I knew from my experience working through a clinical rotation at a particular hospital that I ended up going to, I knew that, from my experience, that we did IVPs. Now, an IVP is a radiology procedure to detect kidney stones, whereas you could also have a CT of the abdomen and pelvis. Totally different exam. IVP is approximately $1,500, whereas a CT of the abdomen and pelvis is going to run you anywhere from $3,500 to $5,000. I explained when I went to the emergency room, I wanted the IVP because I knew I could not afford the CT scan. Perhaps that speaks to your point about a knowledgeable customer going in and knowing what services should be available and requesting those particular services.
Now, had you had insurance, would you have made it a point to know the difference between the two, or would you have made it a point to make sure you got the cheaper one, or would you have been like, well,
Well, see, the thing is, I probably, just given my nature, I probably would have continued with the request for the IVP, just because I would think it's saving someone money. Obviously, it's not helping that particular hospital by not being able to pay for their CT scanner, which is $1.5 million or what have you. So yeah, I probably would have, but perhaps, speaking to your point about the ignorance of the consumer, perhaps it could be impingent upon the insurance companies to provide incentives for their customers to say, hey, look, we have the opportunity to provide you with, much more affordable healthcare providers. We want to direct you. I think that's sort of what they do when they provide PPOs as opposed to
Right, they have little deals with
Right.
physicians and departments and things. What they could do at hospitals is just give you a menu of services with prices listed next to them. That might help, and then insurance plans will follow suit. But we're getting too close to the end of our time. Final thoughts, State of the Union, thumbs up, thumbs down, in the middle. What do you think?
Well, seeing that I am a libertarian, a comforting libertarian, or was it compassionate
Yeah.
libertarian? I don't believe in throwing Granny under the bus because I believe that she did pay into her Social Security and deserves that. I would have to say, I would say thumbs down only because I would have, from my perspective, would have liked to have heard more about how President Obama was going to seriously address spending cuts. This whole $4 trillion, I think it's over it's not 1 year, it's 10 years. I hearken back to the Soviet Union and 5-year plans. I mean, sure, it's nice to make these budget decisions when you're not going to be out of office and just backload the expenses the last 2 years when you don't have to pay for it politically. So I would say thumbs down.
Andrew, what do you think, buddy?
Thumbs in the middle. It's
Yeah.
what I expected from Barack Obama. It's
Yeah.
it was what Obama.
It
is,
is what it
yeah,
is, right? Yeah. I think I'd go pretty much with that, sort of thumbs in the middle. Not a whole lot of exciting new material. I did like some of the things that he had to say about education, but a lot of it was just more of the same rhetoric.
Some of our viewers might be intrigued to see some of the stuff that you've talked about today, where more of that might be discussed. Is there any website or place where they might go?
I'm glad you mentioned that. Yes, there are actually two websites that I'd like to bring up for your viewers. One would be Campaign for Liberty. That's basically supported by Dr. Ron Paul. He espouses the whole audit the Fed. Focusing on the limited government, but a healthy government, a government that can sustain itself. The other one would be antiwar.com. There is a wonderful writer. He's the editor, Justin Raimondo, I believe his name is. Very influential individual. He speaks very provocatively about the notion of how our country is working towards what it does overseas. So I would definitely recommend those two websites.
Well, thank you so much for all the insight that you've helped us provide this evening, Stephen.
Oh, I'm happy, Daniel, to be a part of this. I appreciate you allowing me here to speak.
Well, unfortunately, this wonderful episode is coming to a close. Thank you all for tuning in to our dynamic current offering brought to you by Octech Solutions and Blissful Blessing Events. We hope to see you again soon. I'm Daniel Hayes. This is our guest, as we mentioned, Stephen Manila, and my co-host, Andrew Blackmore, signing off.